We wanted to welcome everyone tonight and thank you all for registering to participate in this important topic on teen emotional health. I'm Octavia Marsh, the Executive Director of Hanover Cares Coalition, where our mission is focused on youth substance use prevention. We know that substance use and mental health are often co-occurring disorders, and we're pleased to be part of this discussion tonight. Tonight, we have Felicia Baez, Behavioral Health Wellness Specialist at the Hanover County Community Services Board, as our technology moderator, and she'll help to manage the Q&A and the chat box features. Tonight, we have an incredible panel of speakers lined up for you, including Grace Gallagher, Executive Director of the Cameron K. Gallagher Foundation, Honesty Liller, CEO of the McShin Foundation, Laura Robertson, Behavioral Health Wellness Specialist with the Hanover County Community Services Board, Maren Scalone, ACES Community Program Admin Specialist with the Department of Behavioral Health and Developmental Services, and Kim Sterling, Intervention Counselor with Hanover County Public Schools. These panelists will cover topics on emotional health, including depression, suicide risk, lived experience, self-care strategies, resilience, and resources. Each panelist will share for about 15 minutes, and we will have one video recording from a panelist who could not physically be on the session tonight. We'll have a Q&A discussion at the end, so please submit your questions throughout the presentations using our Google form link, which will be shared in the chat. All questions that are submitted are anonymous, and we encourage you to ask questions and engage our panelists who've graciously provided their time tonight for this important discussion. At the end of the webinar, we'll also provide you some resources and share an anonymous evaluation link to gauge your feedback on the event in order to help us continue to provide content that's relevant and valuable to your family. This webinar is being recorded and will be available to view later on YouTube, and there will also be a Spanish translation recording available on YouTube, and we will not have a live translation during the session tonight. We'll also be sharing all slide presentations from tonight with registrants, along with the evaluation and resources shared. Felicia, next slide, please. As a public health professional and one who works toward the prevention of youth risk behaviors, I'm pleased to see the U.S. Surgeon General, Vivek Murthy, issue an advisory just in December 2021 focused on protecting youth mental health. I'd like to share an introductory excerpt from this resource to orient you to our focus and reason that we're all here tonight. I also want to encourage you to explore this resource further following our program for tangible and actionable information that you can do to help keep teens safe. This is the introduction from the Surgeon General. Every child's path to adulthood, reaching developmental and emotional milestones, learning healthy social skills, and dealing with problems is different and difficult. Many face added challenges along the way, often beyond their control. There's no map and the road is never straight. But the challenges today's generation of young people face are unprecedented and uniquely hard to navigate. And the effect these challenges have had on their mental health is devastating. Recent national surveys of young people have shown alarming increases in the prevalence of certain mental health challenges. In 2019, 1 in 3 high school students and half of female students reported persistent feelings of sadness or hopelessness, an overall increase of 40% just from 2009. We know that mental health is shaped by many factors, from our genes and our brain chemistry to our relationships with family, friends, neighborhood conditions, and larger social forces and policies. We also know that too often, young people are bombarded with messages through the media and popular culture that erode their sense of self-worth, telling them they're not good-looking enough, popular enough, smart enough, or rich enough. That comes as progress on legitimate and distressing issues like climate change, income inequality, racial injustice, the opioid epidemic, and gun violence feels too slow. And while technology platforms have improved our lives in important ways, increasing our ability to build new communities, deliver resources, and access information, we know that for many people, they can also have adverse effects. When not deployed responsibly and safely, these tools can pit us against each other, reinforce negative behaviors like bullying and exclusion, and undermine the safe and supportive environments that young people need and deserve. All of that was true even before the COVID-19 pandemic dramatically altered young people's experiences at home, at school, and in the community. The pandemic era's unfathomable number of deaths, pervasive sense of fear, economic instability, and forced physical distancing from loved ones, friends, and communities have exacerbated the unprecedented stresses that young people already faced. It would be a tragedy if we beat back one public health crisis only to allow another to grow in its place. That's why I'm issuing the Surgeon General's advisory. Mental health challenges in children, adolescents, and young adults are real and they're widespread, but most importantly, they're treatable and often preventable. This advisory shows us how. To be sure that this isn't an issue we can fix overnight or with a single prescription, ensuring healthy children and families will take an all of society effort, including policy, institutional, and individual changes in how we view and prioritize mental health. This advisory provides actionable recommendations for young people and their families, schools, and healthcare systems, technology and media companies, employers, community organizations, and governments alike. Our obligation to act is not just medical, it's moral. I believe that coming out of the COVID-19 pandemic, we have an unprecedented opportunity as a country to rebuild in a way that refocuses our identity and common values, puts people first, and strengthens our connections to each other. If we seize this moment, step up for our children and their families in their moment of need, and lead with inclusion, kindness, and respect, we can lay the foundation for a healthier, more resilient, and more fulfilled nation. Okay. Felicia, do you want to go back to the last slide?
Yeah, so sorry, I was having some technical difficulty. Are you able to make me the co-host again so I can show my slide? I apologize, everyone.
I cannot make you a co-host. One second. I'm just going to wrap up with this last slide. Tonight, we just want to emphasize our why, and we're here tonight to reduce stigma. This is an excerpt again from the Surgeon General's report, and just to emphasize the data and the statistics to bring us together. And this is what we're going to talk about tonight with all of our panelists. And then this is just a graphic, just, to orient you all to what our young people are facing. We live in a technologically advanced society and culture. And so, again, reducing stigma is our focus for tonight. And so I'd like to open up with our first panelist of the night, Grace Gallagher.
Hello, how is everyone doing tonight? I'm so happy to be here. I'm so excited to be a part of this panel. And wow, what a great panel this is. I'm just looking at everyone on board and all the great work that's happening. And I think that everyone out there paying attention and listening to this right now needs to see what connection is. And this is a group of people here that are committed to absolutely giving mental health a priority in all of our lives, but especially our kids' lives. And to be a part of this is just really special. So I want to thank you for asking me. And I just feel grateful to be in such great company doing, all of you are doing amazing work. So I'm so grateful for that. But yes, I'm Grace Gallagher. I am the executive director of the Cameron K. Gallagher Foundation. And this foundation is in honor of my daughter, who passed away of an undiagnosed heart condition, but she suffered from depression and anxiety. So I come at this from a lot of different angles. And one of the things I really want to start with talking about right now is the importance of awareness. So if we don't know what we're talking about, then we can't get to the next step, which is identifying words, identifying coping skills, and going to a healthier part of your life. So awareness is really what's happening. What is happening in my body? What am I feeling? And there are so many kids out there that'll say, I'm just feeling sad, or I'm feeling anxious, or I'm depressed. And we need to give them lots more words, right? So if you say, I'm feeling sad, okay, well, tell me about that. Are you feeling sad? Are you feeling low? Are you feeling teary? Questions are a great way to really find out where our kids are. And we got to talk about this, right? So it goes back to that stigma. If you don't talk about it, then it's like people feel like they got to hide in the corners, right? And our kids think, oh, something's wrong with me. If nobody in my family is talking about this, then how am I supposed to put words to what I'm feeling? Because the kids are watching us. They're watching all the adults around them. So really giving them true words and identifying like, okay, you feel sad. Let's talk about that. Or what about the kid that says, I feel anxious? Okay, well, what is anxious? What is anxious in their vocabulary? Tell me more about that. Are you worried? Are you nervous? Are you scared? Are you hyper? There's lots of different ways that we can help give our kids more words that gives them more self-exploration. Because when you become aware and you start giving those words, you become self-aware. And we all know that when you're self-aware, that leads to self-regulation. That leads to self-regulation, whether it's an outburst in behavior, whether it's going to a negative coping skill. It is all about self-awareness, giving those words, giving permission to talk about those words, giving permission to say, right now is hard. It doesn't have to be like this forever. So let's go back in our minds to where we were when we were 14, 15, 16 years old. The biggest thing that happened in our life felt like the biggest thing that happened in our life. And we got to understand that as adults. We can't blow it off, because what we're teaching them is that when that big thing is happening in their life, let's put words to it. Let's be aware of how it feels in our body. And then let's move on to how we want to handle that, which kind of goes back to what is the role of the caregiver or the parent in these kids' lives? Because it's not just the parent. It's just not just who they're going home to at the end of the day. It's the teachers, it's the coaches, it's everybody in their life. So what is their role? You know, they get annoyed with us and they act like they're not listening and they're not watching, but they really are. And so how we approach our mental health is so important. It is so important on how we are taking care of our mental health. And at the same time, let's face it, it's hard as adults. It is really hard as adults to not always react to those teens and children and adolescents that are in our life. So I just want to remind everybody, and I will probably botch this quote, but Viktor Frankl said, there is freedom between stimulus and response. And it's that space between that gives us freedom. So as adults, that stimulus of whatever comes at us from our kids, whether it is a behavior of theirs, whether it is a concerned counselor, whatever comes at us, you have to take that moment, you have to pause, and then you have to choose how you're going to respond, because our children are watching. And they're watching how we respond. And if they watch us take a moment and take a breath in different things in our life, then they may just do that in theirs. The other thing as adults is that we really try to fix things. We try to always have the answers. It's okay to be human as an adult, and it's okay to say, I don't have the answers, but we can figure it out together. And where that comes in a huge, huge way for our kids is to truly active listen. As they're talking to us, as they're melting down in front of us, as they're having a total tantrum in front of us, are we in our head constantly thinking, how are we going to fix this? What is the answer? Or are we just holding that moment for what it is, a moment in time that feels out of control? And then you learn a lot more of what's happening with that individual, with that teen in front of you, as opposed to the entire time you're going into fix mode. It's hard. We want to fix these things. We want to have all the right answers, but it's okay that we don't. It's that presence. It's that time to say, I got you. We're going to figure this out together. And that kind of goes into the resilience piece of things. So let's talk a little bit about resilience. What is the true definition of resilience? Because we all have a different definition. The psychological definition of resilience is the ability to bounce back to a balanced state after facing disruption in life. And I'm a visual person. So what I like to think about is a rubber band. It gets stretched and stretched, but we got to get back to that form so it can hold what it's supposed to hold. So think about that in life. You're being stretched and stretched, and you've got to be able to get back to that form so that you can hold yourself in a healthy way. So psychologists will tell you that the 5 pillars of resilience is self-awareness, mindfulness, self-care, positive relationships, and purpose. And the number one factor in becoming resilient in your life, in your kids' life, is positive relationships. And it's those relationships they build over time. It's those relationships that are there always, so that when a challenge does come, they have like a North Star. They have something to go back to. They don't even know that they're going back to that. But the more you surround them with positive influence, and sometimes that's a role model on the TV, and sometimes that's a role model in the grocery store that you don't even know the person's name. Surround them with positive relationships. They will be able to become more resilient when that happens. You know, Stephen Covey has something that a quote I'd like to share. And he says, begin each day with the blueprint of my deepest values firmly in mind. Then when challenges come, make decisions based on those values. I encourage all parents, all teachers, all coaches, that when you are with children, that you have a group of maybe 3 core values, whether it's for your team, for your family, or for your classroom, so that when there's a challenge or something happens, they know that those 3 core values they can go back to. They can make decisions on those 3 core values. They can progress on those 3 core values. And then I also challenge you as adults to look at, how do you face challenges? How do you become more resilient? Because again, they are watching. So when our kids watch us and you are faced with a challenge, do you face them? Do you tend to ignore them? Do you tend to deny them? There's no judgment. Just have some self-awareness there for yourself. Just go ahead and say, how do I handle this? Because every day is an opportunity for us to grow and be more and be better. We're not locked into a box of who we were when we were 5, 15, and 25. So let's show our children that growth mindset. Let's show our children where we've made our mistakes and where we'd like to improve on being resilient. And that kind of leads into the next thing, is that destigmatization. As adults, how are we approaching mental health? Are we making it a natural, normal part of life? Do we have a self-care plan every day that is just like taking a vitamin? You know, it doesn't have to be a crisis. It doesn't have to be a day that is hard. What is it you're doing every day? Share that with the people around you. Not just your teens, share it with your peers, your coworkers, your neighbors. Are we normalizing the conversation? Are we normalizing the conversation by saying, it's hard, I'm having a bad day? And I often share this kind of analogy, and I share it one way with parents and one way with kids. And what I say with parents is, we all can't wait to say what colleges our kids got into, or if they're the captain of the lacrosse team, or they was asked to go to this chorus concert, right? We love it. And we should be, we're proud. It's, they work hard for it. Absolutely. We should be proud of that. But how many parents say, I am so proud of my child because they go to Resource 3 days a week and they are killing it in Resource? That's another part. Watch our kids, let our kids see us celebrate the whole person that makes us resilient, that makes us into a growth mindset. And then another way I look at destigmatization with kids is I tell them, like, hey, when you've broken your arm and you come to school with cast on a Monday, everybody signs your cast and everybody wants to know what happens. Were you on a zip line? Were you on a swing? Were you doing a cartwheel? What was it? And you share your story and they sign your cast. And when you are in that cast for 2 weeks and it starts getting so itchy and annoying and you just want to rip it off, you look down at that cast and you see all these funny little doodles and encouragement and support. What would happen if over the weekend you made a poster board that said, I had a panic attack 2 nights in a row and I'm having a really hard time and my thoughts are spinning? Will you sign my poster to show me you care? And then when you're sitting in your room and you have that poster up there, what would it be like to look up and be like, wow, I'm not alone? Because that human connection is so important. Isolation has hurt all of us. We get it. We are in a pandemic. We couldn't expect everything that has happened. Before the pandemic, isolation and loneliness was a problem, and now it's just been exacerbated. So let's find ways that we don't self-isolate, that we show with our children how not to self-isolate, that they aren't alone in their thoughts, and they're not alone in their worries, and they're just not alone. People are out there. Everyone goes into school wearing an invisible backpack. And in that backpack is all kinds of things that parents, best friends, teachers don't know about. But if we looked at each other knowing that we're all carrying an invisible backpack, share that with your kids, share that with the people. Know that maybe that person that didn't turn in a paper was because they are not sleeping because of panic attacks, not because they're lazy. Or maybe that person that's not returning your teen's texts, keep reaching out. You don't know everybody's story. And we can have empathy and we can feel like we're not alone. It's so, so important. Isolation not only hurts your mental health, it breaks down your immune system. So let's get out there and go on a walk with one person or with your dog, or reach out by text. Even if you don't feel like it, just keep reaching out. That connection can save a life. It can save your own life. It can save your own mental health. So never, ever underestimate the power of human connection. And the last thing that I want to say is there are resources out there. Parents, you're not alone. Teachers, you're not alone. We all have a brain. We all have mental health. We all have to take care of each other. We have to lift each other up. There are so many resources out there. You can go to our website, the ckgfoundation.org. We have a resource page there. We offer conversations with CKG that is specifically for parents, discuss all kinds of different subject matters. We have the Cameron K. Gallagher Resource Center at the Virginia Treatment Center for Children. And what's so beautiful about that place is that they have parent navigators that will answer the phone and they will help you. It's like a GPS system. We're parents, we're trying to figure this out and we don't always know where to go. And so they'll help you, they'll guide you in the right direction. So I just encourage you, everyone out there, always prioritize your mental health. And that sometimes we're going to have down days. And sometimes that day is going to go a little bit longer and a little bit longer. Be aware of yourself. Be aware of how you're taking care of yourself. Be aware of how your body feels. Let's become self-aware so we can all self-regulate. Let's teach that to our children. Let's keep this conversation going every single day. How many times do we ask our kids, who'd you sit with at lunch? How was your day? How was soccer practice? Okay. How about saying, tell me, you woke up this morning, you seemed a little off. How's today on a scale of 1 to 10? How do you feel? Did you feel worried today? Did you feel anxious today? Did you feel great today? Oh, let's celebrate that and know that on those days that you are worried and anxious, you can come back to this because you know you've worked through other days and that you know that there is health and happiness that is unique to you on the other side. So thank you so much for prioritizing mental health and being here tonight and listening to all these wonderful people and letting me be a part of it. I really appreciate it. Thank you so much.
Thank you so much, Grace, for all of the great insight and information shared tonight. Our next panelist tonight is Honesty Liller, CEO of the McShin Foundation.
There we are. Sorry, y'all are controlling my video here. I am Honesty Liller. I am first and foremost a woman in long-term recovery from the disease of addiction. I have been drug-free since May 27, 2007, so almost 15 years. And I'm a proud born and raised resident of Hanover County, as well as a mom of a 12-year-old that attends school here and a 20-year-old that graduated a couple years ago and now is in college and hopefully starting nursing school soon and now works at a hospital. So I have a little bit different perspective. Grace, you're amazing. Your organization is so awesome. And I love everything that you said and everything that you guys do. So you touch my heart every time I hear you. But a couple of things I guess I wanted to discuss tonight is what we see at the McShin Foundation is what I wanted to touch on really quick. As far as I've been doing this for almost 15 years. I went through McShin myself. I did drugs from age 12 to 26. I started out smoking weed here in this county. I did acid and drank, and I just wanted to fit in. You know, I really just wanted to be a part of, I wanted to be cool, whatever that even is supposed to be these days. But I just wanted my friends to like me. I wanted to have friends. I had such a negative outlook at a very young age about myself, about my body, so many different things. I did grow up in a household that was not that great of an atmosphere, to be honest with you. So, and I don't blame my parents whatsoever for my addiction. It's just the cards that I was dealt. And early on, you know, using drugs, you know, specifically weed, like I just, again, wanted to fit in, but I liked it. I'll be honest with you. I liked it. I went to concerts. I had the freedom to do whatever I wanted to do as a child, because of my situation at home. So I was out all the time, in and out. I lied. My name is Honesty, and I lied over half of my life. And I was really good at it. So I got to hide my addiction for 5 years. Well, my drug use, I really didn't get addicted until I was 17. When I was 17, I found heroin and I fell in love immediately. My brain and opiate receptors in my brain went off, had a party in my brain. I remember still the first time I used it. And after that, about a few months later, I overdosed and got Narcan, which Felicia does a good job, you know, training the community about naloxone. So it brought me back to life. And then that's when my parents found out I was on drugs. So for 9 years, they tried to fix me. You know, they tried to fix me. They didn't understand the disease of addiction. They didn't understand why I could not just stop using drugs. And for me, it was a multitude of things. Being on opiates, it attacks your central nervous system. So you need it all day, every day, or you get what we call dope sick, which means withdrawal. So you get sick. It's like the flu times like 500. It's really bad. And it was that void that I kept filling, that I didn't know how to really be a human. I didn't know how to love myself, and let alone, you know, like myself. And it just kept filling in so many voids in my life at a very young age. And those 9 years were pretty bad. And to my this way, that's my book. It's my first published book. It's a lot that will help you, to be honest, to understand like what addiction is. It talks about my whole life, and A lot of it's about addiction, but then, Recovery Life rocks, and it's amazing too. And things that I've gone through as a human in recovery and as a mom. But like addiction is real. And sometimes, at McShen, what we see, it's just heartbreaking to me. I'm 41 years old. I'm proud and very grateful to be this old, to be honest with you. I shouldn't even be here, but seeing these kids, and I call them kids, like we have 13 recovery homes. So right now we have like 127 beds for the humans that we serve. We're getting ready to get another house because we're full. So the addiction crisis is huge, and it's gotten even bigger since COVID. And they're young, 20 to 35 range is usually who lives in the McShen Foundation. I mean, we get older as well, but that is the majority throughout the year. And what that means is these humans are already getting addicted to harder drugs at a very young age before obviously they find McShen. And a lot of that is opiates. Opiates and alcohol are really the two main things right now that we've been seeing this past year. And meth is coming back strong. I think it's getting harder since the spotlight has been on the opiate epidemic for about 3 years now, 4 years now. I think it's getting harder for the fentanyl and everything, to come in here. So a lot of people are making meth with all kinds of chemicals. But these kids that come in, they're all walks of life. They're, from great homes, from not so great homes, some are actually homeless. And it is our job as people that are in recovery, because all of our staff are in recovery themselves from addiction, is to try to teach them on a day-to-day basis, not just take away the drugs, but also learn how to love themselves. Most of us, and some of my childhood trauma is in the book, a lot of us come from some form of trauma with no fault of our own. Again, the cards that we were dealt, and not everyone has it, but for the most part, when you unpack your addiction and unpack your drug use, there's always something, and it could be something small, it could be something huge, it could have been ongoing childhood trauma, but for the most part, something happens, and that could be as far as bullying, that could be as someone broke their heart or mentally abused them or physically abused them, but they didn't tell their parents, so that it just kept happening. There's so many stories I hear on a day-to-day basis that break my heart as a parent, and also a woman in recovery, but more as a parent. As I'm getting older, it's really, really affecting me more in my job role, because my kids are getting older, and it's scary. I mean, it's scary out there right now. It's the scariest it's been, to be honest with you, since I've been working at McShen. And McShen saved my life. So I went through McShen when I was 26. I lived there for 5 months. And now both of my kids have been raised at McShen. I mean, we have our own home and everything, but they have definitely seen the realness, especially my daughter, because she was 5. She was born with my drug use. She was born in withdrawal from heroin, and I didn't get into recovery and find McShen until she was 5. So both of my kids have lived experience she has a lot of lived experience because she was born with drugs in her system, but seeing the realness of addiction. So I'm going to spin that a little really quick. So that's just a little background about me. But the realness of like having these conversations like Grace was talking about, there's depression, anxiety, and there's drug and alcohol use, it just is what it is. And, for me and my husband's in long-term recovery, like we do the best that we can. And I call myself a real model, not a role model. And what that means in our household is we keep it real with our children. I'm not going to send them graphic YouTubes of someone shooting heroin or anything, but they both know. And Destiny, my daughter, that's 20 now, she knows a lot more than my 12-year-old son about my addiction, and what it does into the humans that we serve at McShen. When so-and-so goes away, where are they going? Most of the time it's jail or death. And my daughter has been to funerals with me because they got close, to a lot of people at McShen, when I couldn't afford babysitters, and, they just needed to be up there with me. And I'll be honest, it's one of the awesomest, coolest place for my children to be. I'd rather them be there than the places I was taking my daughter when I was using. They may hear some F-bombs, but they're not, they're in a safe, loving, hugging, caring environment. And that's what recovery is. So my kids, I mean, I can't prevent them from using drugs. Like I can't, there's no way. This is how I parent, hopefully you'll get a couple tips. I mean, or judge me, either way, it doesn't really matter because this is how I'm hoping to stop the generational addiction, in this household. And what we do with our kids is we just have conversations with them all the time, especially my older daughter. But now we're starting to really have a lot more conversations with our 12-year-old son. He'll be 13. There's a lot going on with social media already. And just the whole puberty and who am I and what am I doing, on this planet. And with our daughter, we've been through some things with her, and that's her story to tell. But it's we have these conversations. It's not for us, we don't in our home say, just don't use drugs or you're going to get punished. You're going to get punished. You're going to get punished. That's just not how we parent. She has gotten punished. Gosh, taking that phone, you think is the end of the world, but we've had to do it, for some situations that involved alcohol. And you still have to be their parent, right? But on the other end of it, I want my children to be able to come talk to me and be safe with talking to me, because I didn't have that first off as a child. And being able to talk to your parent and not necessarily, oh, I can talk to my mom that I just took 10 bong hits and I'm not going to get in trouble. That's not really what I'm talking about. I'm talking about having the conversation if they do, or if they want to, instead of you better not do that because you're going to get this, and this taken away from you. My personal and professional opinion is that pushes kids away even farther. So, these conversations that we have with our kids is real. Look, man, we just talk to them like this is what happens, or how's school, what's going on. We take our son's phone and scroll through it. We just started doing that actually last night. He's 12. He has a phone. The only really app he has is some fishing app because he's obsessed with going fishing. But we do check his phone. It's our phone. We pay for the phone. He don't pay for it. So it's our phone anyway. So I think that's tips I give parents as well, to remind them, you're the parent, and they are the child. And it's our role as parents to guide them through life to the best of our ability, not them tell us what we're going to do and how we're going to do it. Even though they try, I get it, they try up in this house and it doesn't normally happen for sure. But it's coming from a loving place, not give me your phone right now. I'm going to go through it and see what you're doing. It's if I found something, it was just some random thing. It wasn't even that bad. I'm so what does this mean? So it's more having that conversation with him instead of you better never do that again. And I don't know, that just never worked for our daughter, trying to don't do this and don't do this. So we just kind of had to reprogram parenting probably about 6, 7, 8 years ago. And again, I'm not a perfect parent, but I'm a pretty decent one, I think. And we have fun, we laugh, we joke, but we were serious in this house. And it's because if I didn't work at McShin or if I wasn't in recovery, I may not be, I don't know. Recovery is my life and I thank God for it every single day. But it is how I parent. And I think, when parents call me all the time about their kids, kids come up to McShin all the time under 18 with their parents. They leave them in my office so I can talk to them. They're smoking weed, right? Weed's the big thing right now. And because of the legalization, for me, I started out with weed. Ultimately, I ended up doing other drugs. Is it a gateway? I'm not really here, to say if it is or isn't. I know for me, it opened a lot of doors to other drugs. So for us, talking to my daughter is look, if you're going to smoke weed, just talk to us about it, because unfortunately right now weed is laced with a bunch of stuff. There's so many drugs right now out there that just weren't out there when I was using drugs. So it's I've learned all that through the participants at McShin, which is beautiful on the other end. So I can help to parent my child well, both of them, and teach them what's out there, like these pills, they throwing them in these bowls and pick a pill and kids are dying. Like it's just a really different world. But I do agree with Grace. It comes with like that inner soul stuff. There's so much going on with children right now. And I see it with my own too. You know, my daughter hopefully is getting ready to start nursing school, and this could be some heavy stuff for her. She works at a hospital, nursing school. She got a boyfriend that we may or may not be a fan of. So she's got a lot going on as a woman already, as a young woman. So it's like, I keep having conversations with her, keep having conversations. I'm here. If you need therapy, let me know. If you need this, let me know. Like, how are you? I'll randomly, like if I don't talk to her for 2 days, because she works 12-hour shifts, and she lives still here with us, which is totally cool, kind of, but it's cool. It's cool. She would clean her room better. That'd be great. But someone else will have to teach you about that, because she don't listen very well. But you know, it's really having constant conversation. And I don't mean like every day, oh my gosh, what did you do today? Who are you with? But it is like having these open conversations that your kids are like comfortable with, you know, and I don't know. I mean, like, again, I think these are just some of the tips, and also like know who your kids are hanging out with. I think that is like super important. And that's lessons. These are just lived experience lessons I'm trying to give to all of you that I went through with my daughter, because they're 7 years apart. So now we got a little different experience with our son. You know, it's like, who like just random chicks would just come here and get dropped off, and like the parents never called me, which is cool, you know, but we don't have alcohol, drugs, cigarettes, nothing in our house. But like, I just thought like at age 12, 13, that was kind of weird, you know, and I wasn't like that. I, you know, at least text the parent or called or whatever. We have Life 360 still to this day with our daughter. She's 20, but it's not like required. She just lets me have it on there for my own mental illness and my worry and stuff. So, you know, I think it's like really understanding like what addiction is and what drugs are out there, because there are a lot. I'm not here to scare you, but there is a lot, and it's a ton of fentanyl. And unfortunately, the humans, you know, that are using it are thinking they're taking something else, and it's fentanyl, and they're dying. I mean, I'm just being honest with you and real with you. It was 100,000 deaths nationally. We finally hit that huge number, which is a horrible, sad, horrific thing. Across the nation this past year, the data is out on that. So, you know, keep it real, be a real model, you know, to your child, and do the best of your ability to not only talk to your children, but give yourself grace, you know. And I think that's a lot of lessons I've had to learn as a woman and as a mom, is like giving myself grace, because when I am like in an anxiety mode or depression and stuff, I have to like give myself grace, but also check that as well and call my support network. So have some, you know, parent friends or support groups. There's a ton of support groups out there, you know, for yourself, because for us, society now, even with the COVID, the isolation, it's still kind of go. So it's important to like make the time for your children too, even if they want to hang out with their friends like every day. I think it should be like a kind of mandatory thing, at least once every other week. Y'all have dinner together. We're doing a puzzle in here, me and my son. So I think it's, you know, you're the parent. Like, just remember that you're still the parent. You can be cool and have these open conversations, but in reality, you're still their parent. And your role on earth is to guide them to the best of your ability. So, you know, I'm here to help. McShin talks to parents all the time. We have support groups. We have, you can bring your kid up there. I'm 41, but I have a lot of younger staff too that have a ton of lived experience with addiction at a young age. It's not just me. I have a ton of staff that can help as well. So just give yourself a little bit grace, you know, but also have those open conversations with your kids and let it be a safe space, because there is so much more, like Grace was saying, for these kids with the social media and just like who likes who and body image for these girls. And it's just, and then, you know, how they identify as a human. I mean, this world is just, it's a place to learn. It's a place to learn, and why not start in your home? I tell everybody all the time, and I'll be quiet. I can help people all day long, and I do it nationally. What I do has to start first in my home, though, because the reality of our next generation is living in my home. So in order to help the world, I have to be, a parent to my children, but also have them be able to have a safe space to talk about what they're going through, so they don't live in a bubble and then, do things that they may or may not regret as an adult. So that's all I have. Thank you for having me.
Thank you so much for sharing honesty and always being so authentic in your storytelling. And we personally know your story and know Destiny. So just always, I'm glad for you to just be authentic in that story. Our next panelist tonight is Laura Robertson, and we will have that actually by video. So Felicia, I'm going to turn that over to you to get that video started.
Good evening. My name is Laura Robertson. I work for the Hanover County Community Services Board on the Behavioral Health Wellness team, and I will be talking about teen suicide, why it happens, and what we can do as parents and caregivers to prevent it. To begin to understand suicide, we will break down the topic by discussing it in 3 parts: risk factors for thoughts of suicide, risk factors for attempts, risk factors for death by suicide, and I'll also talk about protective factors and prevention for each part. When it comes to suicide, the first question I am often asked is why? Why would someone, especially a young teen with their whole life ahead of them, want to die? To answer this question, we actually need to answer some other questions first. The first question we need to ask is, where do suicidal thoughts even come from? This is a question that researchers are still working hard to answer. But there have been scientific studies conducted over the past couple of decades that offer promising clues that strongly suggest that suicidal thoughts are biologically based and occur when there is inflammation in the brain. Brain inflammation occurs when the brain's immune system response is activated. This response is an important defense against what our brain perceives as threats to our health. So why is brain inflammation a problem? Well, when brain inflammation strikes, it disrupts the functioning of the brain's delicate chemical balance. It can even cause an immune response in the brain so strong that the microglia, or the cells of the brain's immune response, will destroy healthy neurons and cause harm to the neural networks in the brain that allow a person to form thoughts or regulate emotions. This destruction can even influence basic body functions like appetite, digestion, and how well oxygen moves throughout our body. When our brain's functioning is disrupted, this can lead to changes in our thoughts, therefore creating suicidal thoughts. Inflammation can also make us extremely tired, depressed, anxious, experience psychosis, or lead to mania. The brain controls all of the body's functions, so when brain inflammation becomes a problem, any system in the body can be impacted, and it can make the person feel really lousy. So the next question is, what activates the brain's immune response that leads to brain inflammation? The answer to that question is a lot of things, because our immune system jumps into action when our bodies are being attacked. And there are a lot of things that attack our bodies on a daily basis. Viruses, like the flu and coronavirus, or mononucleosis, Epstein-Barr virus, and the herpes virus, just to name a few. Bacterial infections and other infectious diseases like measles, mumps, or chickenpox. Insect-borne viruses from mosquitoes or ticks, like West Nile virus and Lyme's disease. Brain trauma from concussions or accidents. And they don't need to be major concussions or injuries either. They can be considered relatively minor, but still cause inflammation. Autoimmune diseases like asthma and diabetes, to name a few. Exposure to chemicals, as our bodies will try to fight off damage from these foreign substances. Reactions to over-the-counter medicines. Prescription medications, alcohol or illegal drugs. Allergic reactions to food or the environment. Higher pollen counts often mean higher rates of suicidal ideation. Sleep deprivation, hormonal imbalances, thyroid disorders, lack of exercise, emotional trauma as stress from things like bullying and social rejection are perceived by the brain as a threat. Physical abuse, and really any other type of adversity that causes prolonged or unpredictable stress because it can lead to a dysregulated stress response. When the stress response in our body is activated, whether that's from an internal threat like a virus or an allergy, or an external threat like a bully or worrying about a chronically ill loved one, our body's immune system activates as well. Our bodies release chemicals like adrenaline and cortisol. These chemicals are fine in small amounts, but when a child or an adult is in a prolonged state of stress, the chemicals that person's own body produces become toxic to their brains and can damage neural networks and alter chemical balances in the brain and impact things like serotonin, leading to depression. So now we're back to our first question. Why would a young person with their entire lives ahead of them develop suicidal thoughts? The short answer is that they have an illness in which brain inflammation is an element. Whether it's a problem with an overactive stress response, an injury, or they have another disease is to be determined by medical professionals. I briefly mentioned depression in the previous slide. Not everyone who has depression has suicidal thoughts. Scientists think that this is the case because people with depression who do not have brain inflammation tend not to have suicidal thoughts. Our understanding of the origins of suicidal thoughts will continue to expand the more scientists research this phenomenon. The important thing for us to remember as parents and caregivers is that suicidal thoughts are a symptom or a clue that something is going wrong and medical treatment is required. Sometimes finding out what that is can be straightforward. Other times it's extremely complicated and can take a long time for doctors to figure out. This can cause us a lot of frustration, and people often have multiple illnesses that can put them at risk for developing suicidal thoughts. For youth, we always suggest that people start with their pediatrician, employ other medical specialists as needed. We also suggest that they find a wonderful mental health professional that can help their child develop strategies to cope with whatever illness they have. Each child's treatment is going to be different. So how do we prevent suicidal thoughts? Some ideas are to protect children from abuse and neglect, set up systems that help children be healthy and thrive, provide places where children feel safe, because when they're in places that do not feel safe, it causes toxic stress. Be a great role model and do activities that support brain health, like getting adequate and restful sleep, eating a varied and healthy diet, getting adequate exercise, and playing. Playing is actually doing something that you love to do so much you don't want it to end. Practice wellness strategies. Get treatment when ill, don't wait. Identify food and environmental allergens, even mild ones, to help reduce overall inflammation in the body. Discuss medications with your doctor or pharmacist if you feel unwell after taking them. Get checkups and practice routine preventative care. Reduce stress. Get treatment for emotional traumas to quell that overactive stress response. Develop and maintain strong social connections. Release stress. We often ask kids to practice calming techniques like meditation, but also running around, doing art, laughing with friends. That's also a stress reliever. Give yourself some grace. We can't prevent everything, as genetics are a factor in illness and suicidal thoughts too. The next best thing is to not wait to talk to your child's doctor. So we've talked about the potential origin for a person's suicidal thoughts. Let's move on to suicide attempts. You'll see by the most recent graphic provided by the Centers for Disease Control that while over 12 million people have thoughts of suicide, 3.2 million will make a plan, which increases their risk for making an attempt. And then 1.2 million will actually go on to attempt suicide. Suicidal thoughts are always serious, but most people will never make an attempt. The hope here is that an intervention has taken place and the person has received the medical care and support needed for the suicidal thoughts to either resolve or they are connected with a mental health professional who can help them cope with suicidal thoughts if they are part of a chronic condition. As you can also see by the graphic, most of the people who attempt suicide will not die by suicide. However, preventing attempts is still extremely important, as the person attempting can injure themselves very badly, sometimes permanently, when they engage in dangerous activities as they try to end their lives. It is also extremely traumatic for the people around this person who love them. If we can get people in medical treatment early, we can prevent more of these traumas. So why do a fraction of the people who make a serious suicide attempt die while others live? Well, it has little to do with answering the why question, and it has to do more with how people attempt. How someone attempts suicide often determines whether or not they will survive a suicide attempt. The most common ways people attempt suicide is by overdosing on prescription medications or illegal drugs, through cutting or piercing themselves, and the third is by firearm. As you can see from the graph, the most common ways people attempt do not match the most common ways people die by suicide. The lethality of the means used in the attempt matter. At this point in the presentation, we now have an understanding of why someone might have suicidal thoughts and how they might attempt to die. So what can we do to prevent an attempt from even occurring? Education is a top way. You can take a class like the ones listed on the slide to learn important skills in order to respond to suicide. Knowing how to identify a mental health problem, knowing how to assess for risk, how to ask a loved one if they are experiencing thoughts of suicide, listening to that person without judgment and offering lots of support, and knowing when to seek medical care or crisis intervention services is key in preventing suicide attempts. The earlier we identify a problem and get help for it, the better the outcome. If you are wondering how you can attend one of these classes listed on the slide, all of the regional community services boards offer one or more of these courses. You can find a listing at their website at www.bewellva.org. In courses like the ones I listed on the previous slide, you'll learn about the warning signs in depth. Those details go beyond the scope of my talk today, but I'm including this particular slide for quick reference for parents and caregivers. I'm also including this slide as a reference as it shows clear links of 7 specific mental health disorders that are most associated with teen suicide. I also want to point out that while 90% of people who die by suicide have a mental health problem at the time of death, whether it's been diagnosed officially or not, there is still 10% who don't have a diagnosable illness. This is still being studied, but some pediatricians have expressed concern that they have had patients with no identifiable mental health disorder or other underlying condition die of suicide. These suicides have been impulsive acts. Upon investigation into some of these suicides, it was found that the child simply had access to lethal means and had an event at school or in another setting that prompted the behavior. For example, a pediatrician at a conference I attended spoke about a young patient of his who was on the bus, was reportedly harassed by a group of older boys, egging him on to kill himself when he got home. The boys said that they were participating in some harmless teasing. However, this young child went home, attempted suicide, and later died. We wonder why a child might do something like this, and it really has a lot to do with how a young brain is built. A child's brain develops from back to front, with the brain stem in charge of survival, the limbic system in charge of emotions, and the prefrontal lobes in charge of executive functions. These functions include concepts like the permanency of death, the concept of time, and problem solving. The prefrontal lobes are often called the brake system for the limbic system's emotional accelerator. You'll see this play out in your youth when they may have explosive emotions and have a difficult time calming down or thinking through a problem. Also, without this brake system fully developed, they are more likely to take risks and believe that how they feel in this moment is permanent and will last forever. So a child who is bullied on the bus, told to go home and kill himself because he isn't worth anything to anybody, might think that's true, and not understanding that these feelings will pass or know what to do to feel better, in addition to not understanding the permanency of death, could do something very dangerous if they have the means to do so and there isn't the opportunity for an intervention. The last tip I have for preventing attempts is to know your local mental health resources. These are the people you are going to call when there is a mental health problem brewing, or if the person is readying themselves to make an attempt. I work for the Community Services Board, so I added their information to this slide. However, if you live in another locality or if you have a private provider that you go through, then you would want to keep their information handy. Okay, so let's go back to this slide and talk about who is at most risk for death by suicide. First, means matter. Most people who die by suicide do so when a firearm is involved. The next is by hanging, the third is by overdose, the fourth is by using gas. The fifth is by jumping, the sixth is by other means, and the seventh is by cutting or piercing. The eighth is by drowning. When we are seeking to prevent death by suicide, not only do we focus on all of the preventative methods that we have discussed so far, we also heavily focus on the means. Lethal means reduction campaigns and methods are proven to save lives by not focusing on the why of the suicide, but the how. Because as we've seen, there are many reasons why a person would want to die or make an attempt, but there are only a handful of ways how they may try to die. We don't have a good way to prevent all means. However, we do have a very effective way of preventing suicides by firearm and overdose, and that is to remove access to these common lethal means. It's easy to lock up a gun or remove it from the home temporarily if there is a person with suicidal thoughts living there. It's easy to lock up medications. Typically, when a person's preferred way of attempting suicide is removed, They do not make an attempt another way. So who is most at risk for death by suicide? According to modern suicide theory, there are 3 things that put a person at high risk for dying by suicide. We call it the 3-legged stool. The stronger the legs of the stool, the higher the risk. The first is perceived burdensomeness. The person feels that their families or the world will be better off without them. They feel that they have nothing left to contribute and there is no way out of this pain. They come to believe that this state is permanent. Many people experience these thoughts. Therapies and medical interventions can help weaken this leg of the stool by helping a person identify where these thoughts are coming from, how to cope with them, and how to begin on the path towards recovery from the condition that is causing these thoughts. The second is thwarted belongingness, or the feeling that they don't belong in the world anymore. They no longer have a place. They aren't connected to anyone. They feel that no one can help them and that no one cares. Therapy and relationships with friends, family, their faith community, school, workplace, and other groups can weaken this leg. The third is an acquired ability to enact lethal self-injury. We have mechanisms in the brain that prevent us from hurting ourselves. However, if someone's brain becomes accustomed to pain, to pushing through pain, to getting up close and personal with death, or facing the possibility of their own death regularly, the brain can lessen its fear of this pain, of death or injury, and the person's risk for death by suicide increases, should that person have thoughts of suicide. Medical professionals, first responders, road workers, correctional officers, people who have eating disorders, have been in life-threatening accidents, and military personnel are some examples of populations who typically have this ability. Youth are a wild card in this category because, as previously mentioned, they have not yet developed the capacity to understand the permanence of death. They are natural risk takers and are more impulsive than adults, which puts them at risk in this way as well. Once this leg of the stool is strengthened, there isn't much we can do to weaken it. This is where removing lethal means becomes the effective strategy to prevent death. Alone, these things do not put someone at high risk, but together, they put a person at very high risk for dying by suicide. Our CSB participates in a statewide lethal means safety campaign called Lock and Talk to help address the third leg of the stool. Lock and Talk asks community members to do 3 things: to lock meds, lock guns, and talk safety with their family and loved ones. Lock and Talk started as the Gun Shop Project, a grassroots effort in Southwest Virginia by gun shop owners who were concerned by the fact that they had sold guns to individuals who later, sometimes within hours, used them to kill themselves. The gun shop owners decided to educate themselves about the warning signs of suicide and learn how to talk to patrons who were having mental health challenges. They hung suicide prevention lifeline posters and worked with local law enforcement, mental health organizations, and community groups to talk about suicide in order to reduce stigma, so that people felt okay asking for help. They encouraged customers to practice good gun safety and lock up their guns and store ammunition separately. They provided cable lock demonstrations and really pushed the message of safety along with resources to customers who needed help. Now Lock and Talk encompasses medication safety as well and partners with poison control on this messaging. We get a lot of mileage out of Lock and Talk because the actions the messaging asks people to take can be used in a number of ways. It can be used to prevent children from accidentally ingesting medications, prevent accidental death or injury by firearm, prevent a youth from using or bringing a gun to school and harming or killing others, prevent youth and adult suicide. And it gets us talking about this topic of safety and thinking about mental health to reduce stigma. Stigma is a top barrier to people getting health care for their mental health struggles. When we remove or reduce that barrier, we can help people and prevent suicide. As participants of this campaign, our CSB provides medication lockboxes, gun cable locks, medication disposal packets, and information and messaging about lethal means safety to community members at no charge. These items can be picked up at the CSB, local community events, the public libraries in Hanover County, and the Hanover County Sheriff's Office now partners with us to provide gun cable locks to residents who request them. Lock and Talk is also a hub for resources regarding suicide prevention, and we even have post-vention resources for family, friends, and others who are affected by a loved one's suicide. We can also work with Lock and Talk Virginia to create materials specific to a group or an event. Lastly, I'm also including this slide for reference. Because there is no single cause for suicide, suicide prevention requires a multi-pronged, systems-wide approach. The Centers for Disease Control have effective community models for preventing suicide. The more people we can get involved in suicide prevention, the more people we will be able to save. If you need materials or would like to discuss how to partner with Lock and Talk to distribute this messaging, please feel free to contact me. And thank you for your help in preventing suicide in Hanover.
All right. Such great information shared in that video from Laura. And we will share all of those resources and those slides again with the email that goes out following this webinar. Our next presenter is Maren Scalone, the ACES Community Program Admin Specialist with the Department of Behavioral Health and Developmental Services.
Hi, everyone. How are you? It looks like I'm just getting my presentation set up. There we go. All right. Hi, good evening, everyone. I'm not going to take up too much of your time this evening. There's already been so many amazing resources shared, and I feel really grateful to be here. And a thank you for taking the time to be here and to take time out of your Thursday evening to talk about something like this. It might feel small, or it might have felt like a large decision after a long day of work, but either way, choosing to engage in conversations and to have education like this is truly meaningful. And so today I want to talk to you all a little bit from 3 different perspectives, but one of them I think is the most important for this evening. I work, as Octavia mentioned, I work for the Virginia Department of Behavioral Health. I work as the Adverse Childhood Experiences Coordinator. So a large part of my role is in working on how does what we experience in our childhood affect our day-to-day lives. I also am a senior in college here, getting my bachelor's in psychology, and hopefully one day continuing a career in clinical psychology at William & Mary. But the most important lens I think that I want to speak to you all about today is just Maren, who recently and graduated in, I guess, 2018, Maren of Patrick Henry High School, and the Maren that was raised in Hanover County, has roots here, has through and through gone to Liberty Middle School, and a PH graduate, and still always will be a Hanover County member, and someone that has personal experience with youth depression, with suicidal thoughts at a young age. And I want to come back to that and talk about that from this lens of now in my position and what I wish that I could have been told and what I would like to share with a bit of my story. And so going off of that, right now in my role with the state, a lot of what I do is talking about these high risk factors, these risk signs, children, students, youth who face acute challenges and adversities in their lives, whether that is from an economic standpoint, an abuse standpoint, a toxic household, and these very blatant risk factors and signs for later mental health issues, whether that is depression, substance use, or suicidal thoughts. And all of those stories are extremely valid. All that was just mentioned of risk factors, risk signs, that's all extremely valid, and those stories have space, but that isn't my story. And it's not the one that I'm going to share about myself and about really what feels not like myself anymore. I always try and make space and do this 13-year-old and 14-year-old girl proud who hit this point, because she went through a lot of things. And though it was a long time ago, and in a lot of ways it feels like I'm trying to recite and reiterate someone else's experience, it was my experience. And in that I grew up in just the most like fiercely loved household, and no one would have imagined or thought that I had hit a very quick onset depression when I did at 13 and 14 years old. A lot of my after that period was ask the question of why, or that was an original thought that comes up, and that's natural to say, why do you feel this way? But I didn't know. Maybe it was brain chemistry, maybe it was a combination of environmental factors, but really the why isn't what I want to, or the how I got there isn't the important part. And what I want to talk to you about right now, what I want to talk most about is who and how they got me out of that, and how grateful I am. And so this middle picture was when I was 13 years old. I was at my 8th grade, I guess that's your like 8th grade Liberty Middle School dance. And that was when I had first started having some serious thoughts of depression. I very quickly from a surface, I was great. I was in sports. I had a consistent group of friends. I had good grades. I was very active, and I had a high support system, a high friend system. And suddenly all of those things had fallen away somehow in ways that I couldn't understand, my family and friends couldn't understand. But very quickly, my appearance changed. I was withdrawn. I had a completely different circle of friends. I was not doing as well in school. I had dropped out of sports. I was instantly at once, I didn't recognize my own thoughts. And in that, I didn't recognize myself, and neither did the people around me. And so I'm extremely lucky that part of my story was that my parents, they chose to see that, and they chose to take that extremely seriously. And that when it seemed like something was wrong, they acted on that immediately. They chose to step into that place with me, to get me help, to check in on me. And we, as a family, we were uprooted and we were untethered. We had no idea that we would be a family that was experiencing this so quickly. We would have never imagined that was something that we would go through, but we went through it together. And the fact that we did go through it as a unit is exactly why I was able to get help via a therapist, via medical attention and support systems. They listened to the advice of professionals. They locked legal means. They checked in on me. I was able to get support from school staff members to get exemptions on certain types of schoolwork. My one job, and the way that I was supported, was my job was to get better. And I'm so lucky that I was given that space. And that space is what I'm asking you all, and what I push to give to students today. And that was, to the right is my graduation photo. And once I hit 18, and that felt like such a long chapter ago, it really wasn't. It was in that space that I learned that I wanted to pursue psychology. I wanted to understand, how do we build communities that are not scared of having these conversations? And in that, I began not afraid to have this conversation and to speak about what I had felt and gone through, because in that, I understood that that's how we strengthen communities. It's how we strengthen people. That is a conversation of resilience, and growing that together is having these conversations, being vulnerable. And that really opened my eyes to the power that can come in that. And so when I talk about this concept of being untethered together, that is what my support system and I were. And really, this is all a long-standing thank you and nod and just gift and a grace to my parents and to my family, who stepped into fear. Because when you're faced with a child who is having really serious thoughts of depression or of suicide, there's nothing scarier than that. There's nothing more frightening than having those conversations. But That is what I hope, and that is what I ask of parents, of community members, is step into that fear, because the child that is having those thoughts, they're scared too. So be scared with them. Just because you are the parent or the one in charge, it doesn't mean that you can't be afraid. You're allowed to be, but just be with them. And oftentimes our fear can keep us from having conversations. We feel like if we don't have the answer to a problem, if I ask my kid, "Are you doing okay?" and they say no, and I don't know what to do after that I don't want to touch that. So I'm just not going to ask. If we have that mentality, we're not going to have some of these potentially life-saving, vulnerable moments with our kids. And we do not have to have all these answers before we support children, students struggling with depression or with suicidal thoughts. And we'll never have all of those answers, but the ones that you do have are, I love you, I'm here for you, I'm going to listen to you, and there are resources out there. Let's talk to somebody, let's get you some help. It's okay to say, I'm scared, I don't know what's going on, but I know that we can do it together. And accepting that fact is huge in opening real conversations with kids about depression and mental health. And so it's just this pledge as a parent, as a community member, as anyone that wants to support someone you think may be dealing with suicide or depression, that I am willing every day to be afraid with you, and that's okay. And it's going to be a day-by-day process, but we're going to do it together. And so in that, the most important thing is to talk about it. There's a common sort of misconception in the space of mental health and in schools that talking about suicide, that's a fear of, well, if I bring these things up, is it going to make it more real? What if my child was just sort of asking for attention? What if it's a phase? If I bring up something, what if I give them an idea? But over and over again in literature and research, we are shown that this is not true. This just isn't the case. And I will be honest, I mean, I experienced depression and suicidal thoughts 8-9 years ago. Social media looks extremely different right now than it did back then, even now. And so any concept, anything that triggers that fear of wanting to make sure that we're not having too vulnerable of conversations with our kids, it's more than likely that they have seen and have been exposed to social media in ways that we would have never thought 10, 20 years ago, the type of content that's being made. And that's not coming from a fear mongering or a scaring place. That's coming from find strength in the fact that our children and students are itching to have these conversations. Find strength in the fact that you're going to add your voice to that of saying, have you heard about this? How are you feeling? What are people talking about in school? Just so you know. And then insert your support, insert your resources. The truth of talking about these things, even in my experience, when I was in some ways uncomfortable because I didn't know if I was ready to receive help, but still the moments that, regardless that I was approached, that I was checked in on, even though I was withdrawn, the constant, yes, I'm fine, get out of my room. My parents still showed up. They fought against me sometimes, but were always fighting for me. And it was in those moments that I felt more understood. There was more empathy. We were vulnerable. There was a far bigger opening to really understand that I needed professional help and to get solutions. And a really important part of dealing with someone that has depression or a child that is experiencing suicidal thoughts, or in just being a support system, if it ever comes to that fact where you are in that situation, which hopefully in some point you will be equipped if that happens. But just know that the child is never alone. The person experiencing that is never alone, but neither are you. It's a really big ask to support a teen, a child that is experiencing a mental health problem. I know that my parents have told me that, that was some of the loneliest times in their life. Was, you can't think of a bigger judgment on yourself a bigger isolating factor than having a child in your home who is saying that they don't want to be here. But that couldn't be further from the truth of the fact that there is no judgment, and that judgment is self-imposed, and removing that stigma not only for the child but for yourself, equipping yourself to have power in your ability to support and to change. There are support systems for parents who are trying to seek these conversations, those conversation cues that were mentioned. There will be resources provided after this presentation. You can seek a referral from a mental health professional if you don't have access, or that's something that your family hasn't approached before. Primary care physicians are great places to start. Pediatricians, great places to start. Also your schools, there's so much that exists within school counseling centers, within your guidance counselors that you can approach as a unit, as parents, and as a family, and reach out to your community, challenge your community, and just start having these meaningful conversations, these vulnerable conversations. And that's a part of destigmatizing that will come so quickly if we can start to speak with each other about not being afraid of the words depression or of suicide until it's too late, and until we're talking about them within a tragic context, but talking about the moments that the support has helped us, moments that we have felt low and lost, and how we came up from that. Those conversations are so important to have. And so if really I could say anything, I was thinking, what do I want to talk about? What do I wish that I had heard, or anything on that nature? That's ultimately the most important thing, is just to accept and to love and stay supported with one another. And I wish that I could, a million times over, it's a large thank you to the people who they stayed untethered with me. They were unanchored, they were afraid, but they chose to fight through that. And they had resilience themselves in the ways that they supported me as parents and supporters, community members, my teachers. And in that, I built my resilience. I had a support system that was able to get me back to a safe and a healthy place, and gave me that space to get help. And that is what I'm so grateful for. And in that, through days of vulnerable conversations we never thought we would have, we grew closer as a family unit than we have ever been before. We became a family that did not have chats about mental health, to families that now have almost daily mental health check-ins. And I wouldn't have it any other way, because that is just like our physical health. It is a part of living, and it can be a really beautiful thing and a beautiful instrument to share. And so please reach out if you have questions about asking questions. Reach out to your children, asking them open-ended, not coming from a place of self-evaluation that you have to be prepared for an answer, prepared to fix. Just reach out, just hear from them how, most likely, if you come from a place and approach from a place of being truly curious about the experience of teenagers and children right now, I think you would be surprised by the authenticity that would bring. Find resources. There are so many out there, wonderful resources. Lock and Talk is a great resource, and those will all be provided. And then ask for help. If you don't feel like you have those answers, that's okay. Don't let that stop you from asking the questions that you need to be asking. And again, that's my contact information. I'm more than happy to speak with anyone, and this will be provided as well. And thank you all for your time.
Maren, thank you so much for just being vulnerable and sharing your story, and just kudos to your parents and your family also. I think that's super meaningful. We hear so much just about people's stories, and sometimes it's in a negative light. And I think like you were able to really just share your story, but also in a positive way of just your support system and that resiliency. So thank you. All right, our last speaker of the night is Kim Sterling with Hanover County Public Schools.
Good evening, everyone. I'm glad to be here, and I think we've had some wonderful conversations up to this point. I'll come in with you from information with what we have been doing in the schools this year. This is our program. It's called Signs of Suicide. If you have a 7th or a 10th grader, you may or may not have heard them speak of this and have even some of these discussions, especially, you know, some of the things like Maren was talked about and what Grace had mentioned earlier, and just having how important it is to have those conversations with our students. So we'll go ahead and get started, and I'll give you an overview. You can skip that one, Felicia. Yeah. But we're looking at why our Hanover County chose this program, Signs of Suicide. It is a universal-based suicide prevention program that has shown a reduction in self-reported suicide attempts and randomized controls trials. And when the research has shown us that when students were in a control group and they were compared to others who received SOS, the statistics shown that there was repeated more favorable attitudes towards getting help for themselves or friends for depression and or suicidal thoughts, and they were 64% less likely to report a suicide attempt in the next 3 months after receiving the SOS training. So the goal of SOS is ultimately to prevent youth suicide. And when we're going through this program with their students and giving you a little bit more of the factual information that the studies has shown, it increases the knowledge and adaptive attitudes about depression. It encourages individuals to seek help on behalf of themselves or for a friend. Definitely reduces stigma. We talked about that earlier with mental illness, physical illness that could ultimately require treatment. Our goal is for it to engage parents and school staff as well as partners in prevention. And it encourages our schools to develop community-based partnerships. And that's, you know, where we are today in with this presentation. So these are the components of the SOS program, and this is just to give you all, as parents and community members, what it looks like when we are in the classroom. And like I said earlier, this presentation is geared specifically towards, we have the middle school curriculum and the secondary, the high school curriculum. So we're looking specifically at 7th and 10th graders. We went into their PE classes in each of our middle and high schools. And when we introduced the SOS program, you know, we set those expectations, talk about confidentiality, and even as the students, you know, if they have a friend or even themselves they're concerned about and want to share that information, we just, you know, let them know this is, you know, it's serious, but we still have to remain in the confines of confidentiality. Then the third thing that we're looking at with the components in the classroom, students watch a series of 3 videos with each of them having different scenarios, and there's a discussion after each one. And depending upon the middle or the high school, they are age appropriate with different types of scenarios that goes with that age group. And then after the students watch the videos, they go through the discussion, then they will complete a screening and the student responses slips. And with those screenings, what we're looking for 3 ways to identify our students in need. The first is help seeking students the ACT. And SOS, the Signs of Suicide program, they have an acronym for ACT, and it's called Acknowledge, Care, and Tell. So it's something easy for the students to remember. The second way that we identify our students is through the student response slip. And then the third way, it's called a BSAD screening, and BSAD stands for Brief Screen for Adolescent Depression. And this screening tool is not a diagnostic tool. We as school counselors, we are not qualified to diagnose any type of formal depression or anything, but that's just a mere screening to let us know where the students are. And then the fifth component is we collect all the forms, and that's the school counselors are presenting these lessons to our students. And after the forms are collected, we assess by a color coding system. Like, think about a red light. Red is severe, they need help. Yellow, they're okay, maybe need to just reach out and talk with a counselor. And then green, they're okay, but still maybe need, you know, a little assistance, maybe just need to check in on the student. And then this last and final step, we follow up with any students that is requesting help from the screening. And with that, when we are handing out or collecting the slips from our students, we just generically say, we may be pulling little Johnny to come in and talk with the school counselor. And we want students to know, if we're coming into a classroom to pull little Johnny, it's not because he has suicidal thoughts. We want to talk to little Johnny just to see how his day's going, what he thought about the program, you know. So the students, that way, we're trying to keep those that are in serious need and could possibly really need, you know, more in-depth screenings. We're trying to keep that confidentiality piece with that student that really truly is in need of maybe more intensive attention to their needs, and talking with them about, you know, their any kinds of signs of suicide that they may be experiencing at that time. And this is a quote, and just to reemphasize the how important and how we believe, as far as Hanover School Counseling, and how much we believe in this program. And looking at this this quote here from David Miller, it says, screening for possible suicidal behavior in students' presence, a variety of logistic challenges. But the fact remains that student screening likely represents the most direct and efficient way to identify potentially suicidal youth. And it is a critically important element of any public health approach, school-based suicide prevention. So there again, that just, you know, helps to reemphasize the importance of looking at a program that is, you know, has the element of you know, having that fidelity in the programming. And so here, this is just this is all 4 high schools and all 4 of our middle schools. So you can look at the numbers there. We had 209 students that were identified as a concern, and then we had 18 out of the 209 that where full assessments were completed. Parents were notified of their concerns and talked with school counselors, and you know, that was carried through with fidelity with parents and students and our school counselors. And then you can see the middle school students there. We had 242 concerns, and then 35 assessments that were completed there. And so parent and community engagement, and we've talked a lot about this, but this is just these are numbers specifically related to our SOS program. So 50 to 90% of parents were unaware of their child's suicidal thoughts. They're again bringing in that important piece of having that communication with your child. 60 to 95% of parents unaware of suicidal attempts reported by their child. And then thoughts of suicide are often hidden because youth are confused, embarrassed, or ashamed, and that could be, for a multitude of various reasons. And then schools and parents must work together to watch for warning signs and reach out for help if needed. And I think that Maren mentioned a lot of these points earlier in her presentation, and there again, just communication between school, home, and checking in on that student, and even counselors. If a child's seeing a counselor outside of school, if there's a release form that needs to be signed so the school and that outside resource can exchange information, it's important because most of the time the counselor is the one that would get these kinds of referrals to be able to help to work with the child in need, something we're kind of about while they were at school. So reducing the risk there again, it seems that, they're opening up, having a conversation about mental health. And of course, we talked earlier about, I think with Laura's presentation, talked about having the guns being one of the most fatal pieces of information, or excuse me, not information, but ways of suicide, not having those in your home, or, storing them in a locked cabinet, keeping them, away from your children. That's just a couple ways that was suggested just to reduce that risk. And here we have watch, listen, and respond. There again, we've talked about a lot of these already with a couple of the other presenters, but just watch for significant changes in the behavior, withdrawal, anger, hostility, increased agitation, irritability. Listen, talk with your child, listening, talk about if they're talking about suicide, sounding hopeless, being overwhelmed, and respond immediately. If your child is showing warning signs, just simply being able to respond and being there with and helping your child. And this is the links to the MindWise innovation that created the Signs of Suicide program that we are working with and that we have been using. And these are actual infographics that you can access through their website, and looking at other tips and tricks with talking with your child, ACT, and there's national resources, and then the website there. If you're feeling concerned about your child, you can take a mental health screening through their website, and that will maybe be a good indicator, maybe be just one of those little tools that might help you to better gauge where your child is and their feelings and their emotions. And another infographic, just a little bit more in detail, and then the Welcome Signs of Suicide for Parents, that is the link directly for parents, and it gives you a list of ideas, signs to spot. You can take the screening, you can watch videos, talking with a child, and then other parent materials. And the National Suicide Prevention, I know that we've had local resources that were listed, but also, this is just another tool for you to have, and also the crisis hotline. That's something that you can reach out, and of course, always 911 if you ever needed that. But that's my information. I work at Patrick Henry High School and Hanover High School, and then I have my email and my phone number there. But thank you all so much, and have a great evening.
Thank you, Kim. Okay. Now we will enter into our Q&A. Thank you all for submitting questions. If I could have all of the panelists come back on camera, and we will begin the Q&A session. The first question that was submitted is to all of our panelists. It says, Hanover County has had several recent suicides of teens. What is specifically being done to address this dreadful statistic?
This is honest. I have no idea. That is not my question.
Well, just like I went through with the Signs of Suicide program, and because the training that we received was in October of 2019, and we were organizing to do our rollout for the county in March of 2020. We know what happened in March of 2020. So we were not able to utilize and really get into the schools to do this SOS training with, our 7th and 10th graders until early this fall and then earlier this spring. So I can speak for, that's what we're doing in our small, portion with all of the school counselors doing this SOS training with all of our students in those grades.
Thank you, Kim. And I'll just add on, much of what we do from Hanover Cares is partnerships just like this event that we have tonight, and just trying to encourage our community to get involved. We know that the schools do a lot, and our youth actually get a lot of education at school. But what we found is just that it needs to continue, and the parents need the education as well. And so that's much of what Hanover Cares does. You've heard about the Lock and Talk statewide initiative tonight. We promote that alongside the Community Services Board, and the CSBs. They also have same-day access now. And so we don't have someone on the panel per se that can speak to all of that, but we'll be sure to share those resources with you all as well, just to make sure that everyone's aware. Hanover County has tons of resources, and we just want to make sure that people have access to those resources, and that you all can, be equipped to have these conversations at home as well. Let's see, our second question is also for all the panelists, and it's with the recent suicide of elite college athletes, what training can be provided to coaches and parents that helps them understand the need to balance sports aspirations and positive mental health? Anyone want to take that one?
So I can have lived experience really quick. I'm not really the suicide professional, to be honest with everyone. I'm the addiction and recovery one, but I do know my son plays travel baseball, and he plays basketball, and he's in school, and he's in advanced math. I know for me as a parent, and the coaches that he does have, he's got amazing coaches on his team. They teach him not just about sports, but respect, your time management. Like they teach way more, at least his coaches. It's a kind of a Hanover, it's MPH 101. It's not like a Hanover County league. But my opinion on what I think coaches should, and really starts with the parents, to be honest with you, is to try to see where your child is mentally to the best of your ability, because it is a lot. I mean, he's 12 and it's a lot on him. And until we feel like it's something that, it is definitely taken a toll on his mental health, we would stop it. I mean, you know, it just is what it is. I know it's great for college and moving forward, but again, our world has changed and our children are under a lot of pressure. And then you throw in sports and you know, you want to be Steph Curry and there's so many things out there like you want to be. It's really important to like you still keep in track of your child, because the coach is coaching 30 kids. It's still your child to try to stay present with, to see how they are, you know, mentally, and how their mental health is too, because I mean, it is a lot, you know, in the sports and college and all that. That's what I'm trying to, my daughter's not even in sports anymore, but the college and having a job, I mean, that's a lot as well. So.
Yeah, going off of what Honesty said, I think from just just a more personal perspective, don't be afraid to state the obvious also. It's better to say things than to have left things unsaid. And don't be afraid to say, you know, hey, you don't have to do this if you don't want to. You might get a response of, what are you talking about? Like, of course I do. I'm just stressed out. I just had a bad practice or a bad day. And so really reinforcing, you know, this isn't your life. This is something that you're doing in your life, and leaving so many doors open so that, a child, a teenager, a college student never feels like they're out of options or that they're trapped, can be really helpful.
Yeah, and I would just add lastly, I know Kim and the school intervention counselors, you all do lots of professional development with staff. And so that would include like the athletic directors at our county public schools. Of course, we have Randolph-Macon College in Hanover County. They have a designated substance abuse prevention professional as well. And so again, I think it's just a matter of their resources and things being done. And one thing we probably don't do enough is just kind of sharing, you know, those stories and what we are doing and what's happening. But there really is a lot that's happening. And so I think the more that you all on tonight can get engaged. Hanover Cares is a great way to start that, because we share a lot of that information, trainings that are available in the community. And so just be an engaged citizen. And I think that's a primary start of how you can just connect and learn a little bit more about what is happening. And then if there are gaps, then you'll also have some connections to the right people to talk to discuss those gaps. See, our third question is for Honesty. Is McShin an option for loved ones to reach out to understand what their family member is going through with addiction and their fight for recovery?
Yes, every Wednesday night we have a family meeting that Moses Wright, he is a CSAC, a certified substance abuse counselor, that does with families. All are welcome, though. It's not just the families of the participants of McShin. It's kind of like an introduction on like what your loved one is going through in early recovery. And he obviously talks about addiction too. But anyone that ever wants to just chat, Octavia, you can give them my phone number, my email, we can set up. You can just come to McShin and see the realness. I always invite people to come see the humans that we serve, because we're open 365 days a week. And like, you can kind of sit in, even in a group, if you would like, you know, with permission, obviously, and just kind of hear some of the stories of our participants, because that is super impactful for family members that, you know, it's just different when you hear all these other stories and see how much is affected. But all of our staff are open to talk to family members to kind of get you to understand. And then there's Family Anonymous. You can Google that. It was one at McShin meeting, but since COVID, I don't think they meet anymore. But Families Anonymous is a good one to check out too. But you're welcome. It's Wednesday around 6:45. Moses does his meeting upstairs on the 3rd floor.
Yeah, and I think one of the other resources I know that Laura had shared in her presentation is BeWellVA.com. And that's some regional Central Virginia resources. And so I know there might be some people watching or joining us that are not in Hanover County. And so I just wanted to offer that website too. So that way you can also get connected with your local CSB and the resources that they also might have. Another question, this is for Kim. Based on your slides, are there more recent numbers? The comment also states that my child is currently at VTCC with suicidal thoughts. She's in the 10th at Mechanicsville High School, and just wondering if she's absent on those days that SOS occurred or was not honest in her answers.
I can't speak for Mechanicsville High School because I don't know what days. I mean, I could go back and look to see through emails and things, but where I don't work in that corridor, I only did the Western corridor signs of suicide lessons, and I apologize for that. I mean, that's something that you could reach out to your school counselor. They could give you the dates as to when they offered SOS over there, but I can't speak to that. And like I said earlier, with the 2019 presentation, that was what was given to me. And I'm sure that those numbers have changed since COVID hit, because we have seen it in air referrals as intervention counselors and with substance misuse amongst our youth in our schools. We have seen a rise in that, but if there was any more current up-to-date information with the statistics from the slides, I definitely would have shared that, but that was what was passed on to me. So I apologize for not having anything more current than what I had.
And Kim, another comment was shared from that, I think from the same person, that they did just send a message to her counselor a few minutes ago and just thanking you for the presentation. And so, yes, Kim serves 2 of the Hanover County public high schools. And then we have another intervention counselor who serves the other 2. And all of their information is on the HCPS website with the listing of those schools. So if there are other people that need to get in touch, that's the best way that you can access their contact information. And in relation to the COVID numbers, I just wanted to share, I think as a state, we're all trying to adapt and learn just, how things have shifted since COVID. And I know from a state level, many of our localities and regions are about to enter into to do some needs assessments so that we can learn more and have some of that data. And so honestly, what's being shared with you all is likely what you will also find on any state website at this current moment. And so we are definitely sharing the latest information with you all. So rest assured that that's what we have right now. And as a state, we're just looking to learn more about COVID impacts on mental health. And right now we know it's mostly anecdotal. We know the changes that are happening, but we will definitely follow up with some concrete data once those assessments are done. Another question that we have is, I think, to all the panelists. Are you all advertising 988, which should be implemented, I believe, in July? Maren, you might have the most perspective on that one.
Yeah, so for anyone that is unaware, really exciting news is that the federal 988 bill was passed, and that is going to be, as Octavia said, moved into and stated into July, which means that now instead of the longer 1-800 number for a suicide prevention hotline, the new federal hotline is 988, which is really exciting. I know that during the pilot just research study along the country that it had passed, it really greatly reduced suicide attempts when that pilot was run, just because having a quick number that is similar to 911 that can really decrease that impulsivity that can happen when someone is experiencing suicidal thoughts. And so I think that, yes, there will be a lot more media that is broadcasting that as that bill gets closer to being passed. This becomes something that is more into practice on a federal and then also a state level.
And Maren, there's another question for you. Is there anything specific that you can share that your parents did that was most helpful while you were feeling depressed?
I think that a lot of things, and a lot of them I probably would not have told you at the time. A lot I was probably extremely resistant to. Number one would be their emphasis on me seeking medical help and therapy. I was obviously at a really low spot. It was not something I wanted. It was not something I had any interest in, but they knew when to push back against me and when it was myself talking versus my depression talking. And they really pushed that I needed to get that help. And in that, I started to slowly believe them the more that I started to feel more myself. And so that, and also just their consistency. They showed up for me even when we were fighting day after day, even when they felt like they didn't have answers. Being physically present with me, even if it was tense, if it was silent, playing a very loaded game of Uno, lots of nights on days when we were all exhausted. I clearly wanted to be withdrawn, not talking to them. And so just showing up for me day in and out, even on hard days, was truly what, I'm so grateful for.
Thank you for sharing that, Maren. And then lastly, we just had a comment that was shared, and it just notes that it's currently taking days in the ER to get a child admitted to any mental health facility in the state, and that we're pretty much at a crisis level. And so it's just a kudos to you all and just thanking you all for your presentations tonight. Okay. Felicia, you just have one more resource slide. If you can pull that up to share with everyone. Okay. We just wanted to share, if you go to the Hanover Cares website, we do have an emergency resource card listed here. We do have physical cards, so these are at the libraries and all the places that you would also find Lock and Talk information, but it's electronically accessible, and I think Felicia just dropped that in the chat as well, and we'll share this out. But on the site, these links are actually hyperlinked. And so if you go to any of these resources, you can directly connect to the website of that resource for more information. And so you can see from this assortment, there's lots of community partners and lots of resources, not just in Hanover, but just in Central Virginia. And then some of these are statewide and national hotline numbers as well. So definitely take advantage of this resource. And many of the resources that were shared tonight are included here, but we'll be sending that out along with the evaluation link and then any slides from tonight. So we just wanted to thank you all for being on tonight, and thank you to all of our panelists for your vulnerability, your authenticity, and just sharing ways that we can continue to keep teens safe. Thank you all. Have a great night.
Bye. Thank you.